Hello, my name is Jake. Today I'm going to be sharing with you a little bit about my microdiscectomy for my L5-S1 right herniated disc bulge. And if you're watching this, you or someone you know might be considering a microdiscectomy, so I hope you find this useful in hearing a personal testimony of how my own went. I also wanted to share this because these are quite common with elderly people or obese people who have disc bulges, but since I'm a pretty fit, athletic 24-year-old, I thought this might be useful to those in the same situation. Before I tell you about how I'm doing 24 hours after my microdiscectomy, I wanted to share a little bit about why I chose to get a microdiscectomy, so that might be useful also. So my pain, my sciatic pain started about 10 months ago. It manifested itself in a burning sensation in my right calf, and it only occurred when I was in a sitting position, and I thought it was a pulled muscle at first, and I finally figured it out. It was a disc bulge. After doing some research online and getting an MRI that confirmed that was causing the pain. So for a period of about 6 months I began seeing chiropractors. I saw 3 different chiropractors who did different treatments on me to try and reduce that disc bulge. Some of the things I did were E-Stim, massage therapy, and adjustments, and spinal decompression, and those things helped temporarily, but as soon as I left the chiropractor's office, they would usually immediately come back, the pain. So it wasn't any long-term fix for my condition, unfortunately. I also received 2 epidural steroid injections, and those lasted only for a period of about 1 to 2 weeks before the pain returned back in full force. And so I'm just mentioning these things to give you an idea of some of the things that you might want to try before you decide to do microdiscectomy. My condition was interesting because the pain only occurred when I was in a sitting position. So for my last semester of school, for example, I had to stand up in most of my classes because I had pain going down my right buttocks and right calf, and it was almost unbearable to sit, so I had to stand up. About 1.5 months ago I saw a chiropractor, the 3rd one, and he tried something called Flexion distraction therapy, which is a form of spinal decompression using a Cox table. And that really was kind of the final straw for my back, because no longer was I in pain only when sitting down, but when I was standing or lying down. So it probably wasn't the wisest decision for me to attempt that. So after that appointment with the chiropractor, I was bedridden for about a month, and I couldn't stand up to brush my teeth or to hold my daughter or to do anything without constant pain. And so I started taking gabapentin twice a day, and that was at 300 milligrams twice a day, and that seemed to reduce the pain enough to where I could lie down in bed. But even on the gabapentin, I was still in excruciating pain if I stood up to do anything. And so I began looking into surgery. Up until this point, I was doing everything possible to not have to go face surgery, because once you do, there's no going back, obviously. And so I met with my neurosurgeon. I met with 3 different doctors. One was a neurosurgeon named Dr. Guffane in Provo, Utah. And he told me that in his office 70% of people are going to feel better after doing a microdiscectomy. I read websites where there's better statistics, but he told me to be wary of anyone who claimed that they would have significantly better statistics than what he had. He's been in the profession a while, so I trusted his opinion. He also told me that 1/3 of people would experience a reherniation of their disc after the microdiscectomy. And so even though I wasn't very excited about those statistics, I didn't really have any other choice. And so I went ahead with the microdiscectomy. And so I'll tell you a little bit about how I'm feeling shortly. But so yeah, just so you understand, I didn't really have a choice because of my bedridden state and being fully incapacitated. And so I was pretty confident in my decision that I was doing the right thing. So I'm no doctor, but I would recommend making sure you do everything you can before choosing to get a microdiscectomy, and talking to people who have had them or have recovered from disc bulges without surgery. It's been a little over 24 hours since my L5-S1 right side lumbar disc bulge was removed through a microdiscectomy. Just to recap, I had mine done via the Utah Neurological Clinic by Dr. Goufain, excellent neurosurgeon. I was kind of bombarded before I chose this place by many various companies that claimed they were minimally invasive and used laser techniques, which I don't have a problem with, but I felt more comfortable going with someone who had a well-known reputation and who is well established, rather than trying to be approached by people who were trying to sell it to me almost. So I went there. Immediately after my surgery, it was kind of rough. I had a very sore throat from having a tube placed down my trachea during the operation, which is normal. It was very nauseous from the anesthesia and other medicines. So I had a little bit of dry heaving going on, not very fun, but that only lasted a few minutes. I was put on some morphine and some medicine to reduce the nausea, and about 8 hours later, I was feeling much better. I didn't sleep at all that night, probably just because of all of the medicines I was on. So I'm looking forward to going to sleep tonight. So what else you would like to know? How did it go? How am I feeling? So the best thing about the surgery was they get you up every few hours to get up and moving, and they want you to do that because that's the best thing for your back. And as I took those first few steps with my nurse and aide assistant, it was a miracle because I had no pain down my right leg and my right buttocks, right hamstring and right calf, where it had been bothering me for the previous 10 months. Particularly when sitting down, it would bother me. It was completely gone. So I have no connection to Utah Neurological Clinic or microdiscectomies, so I'm not trying to sell anyone. I feel amazing, and I have not yet experienced any of the sciatic pain that I had been previously, so I'm very, very happy about that. I have been told on days 3, 4, and 5 your body starts to become inflamed, and so you can feel a little bit of that come back. 2 weeks before my surgery, I started experiencing numbness and tingling in my right foot and toes. I talked with my neurosurgeon today, and he said that the textbook will tell you that once you have numbness, it's permanent, it's never going to go away. But he said in his clinic he sees about 50% of people who will tell him that over a period of 6 months or more it decreases the numbness, or it completely goes away. So we'll just have to wait and see. Mine's still there. Not a really big issue for me though. So yeah, that was pretty miraculous for me to be able to walk with no pain and down the right leg. I talked with my neurosurgeon. He said it was very good that we went in and had it done because my disc had already bulged through the annulus fibrosis, so it was already herniated, not just a disc bulge. and he said my nerve was the nerve root was supposed to be sitting like this, but it was pretty twisted like a pretzel. And so it was a good decision to go ahead with the microdiscectomy for me. So right now I'm standing up, walking around as much as I can. You don't want to overdo it. And so things are pretty good. You just have to be careful getting in and out of bed. They encourage you to not sit for more than 20 minutes consecutively. I haven't sat down very much at all, just because that used to hurt the worst for my leg. And so I'm just trying to take it easy before I start sitting down again. I have a sore back, obviously, where the incision was made and where the bone was removed from the vertebrae. But other than that, things are looking hopeful. So hopefully this has been helpful to some of you who are considering the surgery. And if you follow me along within the next 6 months to a year, hopefully you'll be able to see if this is effective long term for some people who are age younger than 25. All right, thanks very much.